In this recent study that was just came out, the health officials are basically looking at 9,300 people, divide them into two different groups. One group had a blood pressure systolic 120 and the other had 140. And what they found was that magic number of 120 led to 25% lower chance of death and 30% lower chance of cardiovascular disease. So how low your blood pressure should be? Is this as low as we're going to go? What kind of issues are we going to have? And really get some light to shed on this study. I thought the best person to bring in is one of the premier cardiologists, the chair of cardiology at Lenox Hill Hospital. Dr. Varinder Singh is with us, who is very familiar, and this is what he deals with day in and day out, managing blood pressure and prevention in stroke and heart disease. Varinder, good morning, and thank you for being with us.
Thanks for having me, David. And this is a very interesting study, and as you know, a very hot topic, both in the literature as well as just in day-to-day practice.
So I mentioned a little bit about the actual study itself, 9,300 patients over the age of 50. The average age was about 68, and they basically compared two groups. Some were on 3 medications with blood pressure systolic of 120, and the other group with 2 medications with blood pressure of 140. And of course, they found that the lower blood pressure meant, better life, lower cardiovascular disease and stroke. So what is your take on this? How low is low, and what's the message to a lot of people out there who are listening to this?
So, this is, as I said, created some controversy, and hypertension's actually been controversial for the last year. As you know, the government and our guideline societies are based upon a JNC-7, and the JNC-8 was released in 2014. And if you look back at that, it's historically we're kind of trending down on our blood pressure goals. JNC-8 actually was it's a panel of multiple specialists, and that they looked at lots of randomized controlled trials. And they really had 3 goals here. They wanted to look at the threshold for treatment. They wanted to know if the thresholds for treatment actually ended in better outcomes. And they also wanted to look at what medications patients were taking and their outcomes. And so the difference between JNC-7 and JNC-8 was that our old goal blood pressures were 140 over 90 in people over 60 years old. If you look at the JNC-8, for people greater than 60, it's 150 over 90. So we've kind of actually gone up a little bit, become a little bit more lenient on the blood pressure. Now, this study...
What's the reason for that? Let me just stop you right now. Why are we more tolerant for higher blood pressure? Is it because of risk of fall and dementia and other things, or what's the purpose of that?
So the purpose of that is that if you look at people under 60, not much changed. We really want to get people around 140 over 90.
Right.
But people over 60, we went a little bit higher because those patients can have more lightheadedness, more dizziness. They can actually wind up being on lots and lots of medications. And the medications themselves can make people feel lightheaded and dizzy.
And side effects, that's right.
Yeah, the side effects can be a real issue. And the whole thing with the JNC-8 was looking at all of these randomized controlled trials that studied this, 75 to 100 of these trials they looked at. They realized that there was no significant outcome benefit of going to 140 as opposed to 150 over 90.
I see.
But there may have been a benefit in decreasing the medications and the side effects on the medications.